Hi, this is Dr. Trip Goolsby, Infinite Health Integrative Medicine Center. I'm going to talk to you all today about E.V.E. E.V.E is a construct of mine that helps explain epigenetics and how it affects our health. When you consider your health, when you're really young, you have a lot of reserve. That reserve is slowly but surely consumed over the course of your lifetime, and it is based on basically on your genome and the genetic material that's passed on to you from your mother and father. So you get in your genome, in the human genome, in 2001, they completed the Human Genome Project, which told us that we had about 24,000 genes. Well, molecular biologists at that time said, oh, this is great, 25,000 genes. This will be easy. We can cure all of our diseases and everything. So, 24,000 genes will make 24,000 proteins. Well, that turned out not to be the case. And as we work on the Human Proteome Project, the current estimates are that the human body is made up of somewhere around 150,000 to possibly even up to 2 million 2 million proteins. That being said, how are those proteins made and how are they expressed? That is all determined by epigenetics. Epigenetics is the study of all the reactions that take place in and around our DNA based on the exposures we have and the information that is received by our cells. So that being said, that brings E.V.E into the fore here. E.V.E stands for Epigenetic Variability Effector, and I've conceptualized her as a woman that actually it has a robotic function in and around the DNA. And if you can imagine that there's a woman floating around your DNA who is receiving information from outside of the cell to influence the expression of your DNA, that is who you need to think about. So E.V.E responds to the information she receives from inside and outside the body. Inside the body is pretty straightforward. It's basically what environments exist, the metabolism, the hormones, and the responses that are created by virtue of our thoughts and how we respond to stressors in our lives. External information is basically those things we eat, we drink, or that somehow manage to enter into the bloodstream across our skin and the barriers of our bodies. So if E.V.E gets good information from the inside and the outside, she goes in and produces good information from the DNA. If she gets bad information, then she gets angry and starts creating inflammation, oxidative damage, mutations, which results in chronic disease processes such as diabetes, cancer, atherosclerotic disease, coronary artery disease, strokes, and the like. All of these things slowly but surely eat up our reserve. But if you consider that your body turns over about, virtually most of the cells in the body turn over in about 7 years. And in that 7 years time, you want to be making E.V.E happier. So if you're ill, if you make E.V.E really happy by changing your lifestyle, getting good information, having a good hormone and metabolic balance, what happens is that your cells get healthier, you get healthier, and you feel much better. If you make E.V.E mad and she continues to take pot shots, eventually you'll accumulate enough mutations and you'll have a cancer or you'll have a coronary artery attack or something of that nature. So the key to this then is optimizing the input. So input from the outside will be based on your nutrition, your ability and your daily exercise and physical activity. And the inside is going to be your hormone and metabolic balancing and being able to deal with your stress as best possible. Here at Infinite Health, what we do is we take those 4 pillars and we optimize them according to current peer-reviewed research and medical information. And basically optimize your outcomes in that fashion, which in my hands, when I optimize a patient, I get really fantastic results. So if you're interested, come and take a look at our website and give us a call.